I'll start really quickly before I turn it over to Jerry to identify what the problem is. And quite frankly, the problem is we really want to solve the issues that affect individuals as it relates to health care. The problem is freedom. If we can give folks free, and when I mean free, give them choice, give them agency, we can solve the problem. So many people aren't free. And so when I look at the problems in my community as it relates to freedom, I want you all to think about 3 buckets within the social determinants of health. 3 buckets. What do we mean when we mean social? I want you all to think about the environment, the social environment that folks live in. I want you all to think about identity, how folks identify themselves, but more importantly, how others identify them. Then I want you to think about folks' position in life, their social economic status. Those are the challenges and the problems that I face in the city of Detroit. What do I mean by environment? Many of the people in the communities that I serve and I am helping, and they are teaching me just as much as I'm teaching them, live in communities, and many of them not by choice. It's because due to systematic and institutional racism, their neighborhoods and communities have been redlined. And as a result of being redlined, many of those communities have been extracted from resources, or they haven't been tended to. So the environment that in which they live in, and in my case in Detroit, I'm the executive director of a nonprofit called Food Lab Detroit. The environment that many of the community members that I work with every day, their environment looks very bleak as it relates to food retail, not having access to a full-service grocery store, or a sit-down restaurant, or a cafe where they can meet friends and family members over a cup of coffee or a hot tea. The environment. Last but not least, or next, is the identity. How we see ourselves and how others see us. Black, Latino, immigrant. It is this othering that removes us from people who don't look like us, that makes us wash our hands of the problem. So many of the people who I work with identify as African American, Latinx, Latino, or immigrants into our community. And then last but not least, what is their social economic status? Many of them are low income. Many of them stay in marginalized communities. And as a result of all of that, if we look at these problems, Dr. Graham and Jerry and Dave, through what I would call an equity framework or a racial justice framework, many of these problems are because we have failed to deal with racial justice and inequality in this country. And if we can have honest conversation starting today about how we tackle that, we can tackle the problems of healthcare.